warmly welcome everyone this morning to the 8th episode of our AlohaCare Enlivening a Culture of Health webinar series. Last year, we created a 6-part episode series with 18 community leaders through a range of topics that relate to our vision for whole health for ourselves, our families, and our communities. Our esteemed panel today helps us continue part 2 of this series. We're joined by Project Vision, and we're going to discuss community-driven initiatives that bring health services directly to people in need throughout Hawaii, especially on Hawaii Island, Kauai, Lāna, Maui, Molokai, and Oahu. Project Vision Hawaii offers a number of programs that they're going to share with us today, and we're excited to jump right in and learn from them. For those of you who may not know me yet or haven't worked with me, my name is Kaua Fox, and I'm helping to lead this series and moderate today's session. AlohaCare is deeply committed to the great diversity and the distinct cultural groups that intersect with our social and structural determinants of health. And this is a part of our strategy, plan, and actions to increase and better our approach and understanding to those that we serve. At our organization, we believe health quality is synonymous with health equity. And that's a lot of what our plans and strategies and actions are demonstrating for us now. We know that now is the time for us to better understand the cultural and social determinants of health needs of our members. And so these strategies are commitments to our actions and opportunities to work and do better for the coming years. This is captured in our health, cultural competency for health equity plan. That's one part of today's series. And this is our work to eliminate the unfair and avoidable differences in health among populations and groups that are defined socially, economically, demographically, geographically among our members. And this webinar series is a nod to our social determinants of health strategy. It's July now. School is starting in a couple of weeks. A new COVID variant is spiking rates again, and resources remain constrained in many community health service areas. Our 8th episode today will be focused on a healthy vision for people of Hawaii and seeing that vision to fruition with our experts today. The conversation is tied to one of our pillars in our SDOH plan, and that's our neighborhood and built environment. In this webinar, we're going to hear from Project Vision and learn how Project Vision is providing free medical services to thousands of patients, including high populations of seniors, children from low-income families, immigrants, and individuals with disabilities, and they meet them where they're at and help to expand this work throughout islands, and they have a lot of great vision and plans for where they want to go in the coming years. I'm going to just start us off with our first poll. So you're going to see this pop up on your screen. It's anonymous. And this is linked to our topics today and some of the programs that we're going to talk about. Go ahead and just select your answer, and we'll share them at the end of the webinar. And so today, the first polling question is, Hawaii hasn't had a comprehensive vision screening program in public schools since. And this one is always an important one because this is why community-based services, screenings, and mobile health is so important, like we're going to learn today. And without further ado, I just want to start by introducing the team from Project Vision Hawaii. And first I'll introduce Dara Kauhane, who's the executive director. And we have Cindy Tokita, the Oahu community health worker, and Bob Wardlaw, the director of homeless programs. Dara, I'm going to pass it over to you to do the introduction.
Yes, thank you so much, Aloha Kako. Thank you for having us today. It's an honor to be able to share our programs and humbly provide some suggestions on how to work with the populations that we have in common. I'm so grateful to have our director of homeless programs here today, Bob Wardlaw, right before he goes off for vacation. Very grateful, much deserved vacation after a long period of COVID where he's worked very hard. He's really helped to grow our organization from one that focused on just showers previously to now you'll see in our presentation a more holistic view of assisting our brothers and sisters that are living on the street. So really excited for him to share. Then we have Cindy here to my right. Really excited for her to be here with us this morning to share her experience as someone with lived experience. She's our boss here at Project Vision, telling us where we should go with the programs and what would really make a difference to those that are dealing with this trauma and difficult experience. So can't wait for you to hear her story, and so grateful that she's willing to share with us this morning. She really is our inspiration. So thank you so much for having us. We'll jump right into it. So I wanted to share for most of you that may have heard about Project Vision, we've changed quite a bit in the last few years. The biggest issue that you'll notice is that we've merged with the Hawaiian Eye Foundation, the nonprofit organization that I came from for the last 8 years prior to coming back to Project Vision. What's significant about this merge is that Project Vision Hawaii was a vision screening organization. Hawaiian Eye Foundation was a vision treatment organization. And so now that we've merged them together, we can offer the full spectrum of eye health. Not only eye health, we've obviously increased to, you can see here, we've updated our bylaws to include a more holistic view of health and human services, all for the purpose of improving health equity. So I'm really excited to share today what we've learned from our international partners. This organization was obviously formed a long time ago, 1985, in comparison to Project Vision. So we've learned a lot of lessons from our predecessors at Hawaiian Eye Foundation. And I know that when I was working internationally for 8 years, we learned how to set up clinics and surgery centers anywhere with anything, whatever we had. And so that's really helped us to be able to push that forward here locally, being able to provide services anywhere with, no matter what the resources are. We'll figure it out with our amazing team that we have that's committed to really providing the services to those in rural areas. So we go from setting up clinics in island nations, small villages throughout the world, to now providing health to our most vulnerable populations here in Hawaii. And I will say, obviously, with COVID, our international work had to subside for a little bit, but we actually leave for we've been going to Mexico every month throughout the pandemic, our clinic there. But we're very excited that we're finally going on our first mission trip next month. So we'll be resuming that work. And also because of the partnerships that we've made throughout COVID, we're adding some new locations, the Marshall Islands, Samoa, and Vanuatu in next year. So really grateful, another blessing in disguise that came out of COVID. So go ahead, next slide, please.
Thanks, Sarah. So we also are able to deploy our varied fleet during emergency responses. So we've got 2 shower trailers on Oahu, as well as a vision van that could be used for other, could be employed otherwise during an event. Same on Maui and the Big Island. Sorry, sorry, I'm all turned around here. So shower trailers on Oahu, we have 2. We have one on the Big Island and one on Kauai. And then we also have vision vans on Oahu, Big Island, and Maui. And then we're also starting drinking water distribution on Maui.
Yeah, so really excited. COVID, another blessing in disguise. We were able to start some new programs and increase our footprint on some of our neighbor islands. Our first program on Kauai, actually having a trailer there, really grateful to the county who helped us make that possible. And now our newest project with Maui County, the potable water project, our van is going to be shipped over there probably next week. So we're really excited to deploy that new program. But as you can see, we utilize mobile clinics and mobile hygiene trailers to really reach people and get to people where they are, where they're most comfortable. So we're breaking down those geographical barriers, breaking down as many of transportation barriers as we can, and bringing the services directly to people where they are. I have a little picture on the side here. You'll notice the red backpack. Throughout COVID, we created these emergency kits thanks to the help of the Wilson Care Group and Chaminade University, and we put these together so that our nurses could get off the buses and really go tent to tent, door to door. And we'll talk about that later, how COVID has really transformed our organization, not only working off of these mobile units, but also working individually by foot so that we can get to people where they are even further. We're really just trying to break down any of those barriers so that we can increase that access to care. So next slide, please. So first thing I wanted to share, our roots within Project Vision come from our statewide school screenings. So our vision screenings are where we began, and we were focusing on Title I schools, and we have a partner called Vision to Learn. They're from the continent, and they've partnered with us to provide exams and glasses. So we really have a full spectrum of what we can provide in the schools. Every child from a Title I school gets screened every 3 years at least. And then if they do not pass that screening, they'll be referred to an optometrist in the mobile van, which will come to the school. They'll do the exam and the refraction. And as you can see in some of these pictures here at the bottom, these are our glasses distributions where the kids can proudly wear their new specs. So very, very grateful for the growth of this program. We went from just screening, and now we actually have a follow-up and referral program. And one of the systems change I wanted to share with you is over the past 5 years, our team has really worked hard to get to the place where we can have this program be self-sustainable because of your poll question. Since 1995, the funding for school screenings for hearing and vision was cut. And so since then, we and other great organizations like the Lions Clubs and Rotary Clubs have tried to fill that gap so that kids can have the support, have the tools that they need to really succeed in school. And the reason that I was so excited about this program when I first worked for Project Vision 8 years ago is that I was screening juniors and seniors at Waipahu High School. And we found a child who was in a special education, but we found out as a senior that he couldn't see. So he went through his entire school career and was put into special ed because he couldn't see. So imagine if we would have caught that early on, if that funding wasn't cut by the state and he would have had the tools, imagine where he could have been. But I'm glad that we found, discovered and gave him glasses and prior to him joining the workforce. But it just proves that these services are absolutely needed. So I'll tell you a little bit about the steps that were required here. So we had to get a bill passed for opt-out consent. So now we can go into a school and screen all of the kids unless a parent says, no, I don't want you to screen my child. So obviously we can access a lot more students and make sure that they get the service. The second was to create a cooperative agreement with the Department of Education that allowed us to bill for the exams and glasses so that we could bill for those students that did have insurance. This is something that the FQHCs, as you probably know, are also incorporating so that they can go in and provide school-based healthcare to the students. The third step was to work with DHS and to build a health service initiative, an HSI. And this was a state child health plan that would say that CHIP could help to reimburse for Title I school screenings. And then the fourth step was to develop a state trust fund for vision and to find that financial pathway. And so just the last couple months, we've received our first check for the screenings that we've done for Title I schools, which now we won't have to depend on our generous private partners and foundations. We've had some loyal partners throughout the last 5 years to help this program come to fruition. If you don't mind, I'll share them. Kamehameha School, Atherton, Castle, Freeman, Ching, Weinberg, the Zilber Foundation. They've all been our core group helping us to get through each of these steps. And now we're really excited to announce that we're going to be moving on, as we've always planned, to not only provide vision screenings in the school, but also bringing back those hearing screenings. And so I'll share with you, Act 37 was just signed into law this session. And Act 37 says that although there's no funding for it from the state budget, the state is requiring that under the Department of Health, there will be an advisory committee for both hearing and vision, and that anyone that does screening programs will have to abide by the best practices that they establish. And it will require that everyone who does those screenings will be trained, certified, and have to report that data. So it's going to force us all to come together, force the organizations and the schools to work together so that we can provide both health, hearing, and vision to the schools again. So our team is going through the process of, just as we did with vision, doing the same process with hearing. And we're trying to recruit, now that we have these pathways discovered, how can we bring other types of screenings into the schools? So really grateful to University Health Partners and Department of Education's Children with Special Needs Division, who's helping us to develop this new hearing program with our partners at the Lions and Rotary Clubs. So thank you for allowing me to share that. We're very excited that after 5 years, we've finally gotten to this point. And now we can make sure that all of these services are provided statewide. Next.
So we're able to create the safety net through our outreach, through things like the street medicine, in-home services. So that'll include things like primary care, vaccines, which Dara's talked about, the vision and hearing. And then also strongly connected to the mobile hygiene units, which what's nice about the mobile hygiene is that it kind of creates a space, a welcoming space for people, both inside and outside the trailer. So it's a spot where somebody can take a private hot shower and sort of kind of recenter themselves while they're inside. We're also starting to implement some surveys about drug use, and we're in talks to become a needle exchange location as well. We're also, as I mentioned earlier, we're kind of keyed in for emergency response. We've had a few incidents that we've responded to, like some of the hurricanes. We helped out with the Puna lava flow a couple of years ago. And then also from our clientele, we've been able to develop a workforce that we're pretty proud of. That's, to me, I think that's that's certainly one of the best things we've done. It enables us to kind of put our money where our mouth is and help bring people out of their situations. And it's not just a couple hours here and there, but it's enough hours that it is meaningful.
So yeah, just wanted to share. So we've taken what we've learned from our international work, setting up clinics anywhere throughout the world, especially throughout the Pacific, and bringing services into the schools. And we're really grateful that now we get to provide these services to the rest of the community. And so we started, with our mobile vision vans that you saw, and then grew into our mobile hygiene units because we were focused on serving the unhoused population. And now it's really, really boomed for more services that we're able to offer now. So not just health-wise with our amazing nurses and medical assistants and doctors that we've hired throughout the pandemic, but also providing more of that social support as well. And that's the team that Bob leads. really working with each client individually. You can see here in the pictures, the top picture is us going door to door with some of our partners from We Are Oceania and some from some local churches throughout public housing. Throughout COVID, we went door to door offering services, and now we continue to do that post COVID with other types of services. What else can we provide for you and your family? I'll point out, you can see that picture with a view. That's Bob actually doing a Medicaid application with an unhoused client right there with the beach in the background. So you can see we try to go anywhere and everywhere, wherever anyone calls. So really excited to share about our workforce development program and how we've taken, we had to get clever throughout through COVID. Everyone needed to hire medical workers. And for us to continue our mobile efforts and to really provide throughout the prisons and throughout the shelters and on the streets, we needed a committed team as well. And so we're grateful that we had the idea to work with our nursing students, all of the nursing students and programs here on the island. With Chaminade, HPU, and UH, they've been very helpful with sending us nurses and their professors. And it's been a great rotation for them to come with us on the streets and really experience public health in the schools. We wanted to promote the prevention side of things and show them that these are what we can do from the beginning before we get to the treatment stage. So they really got to see both sides by coming out with our teams. So very grateful that because our fleet's grown so much, we've been able to offer to each of the counties that if there is an emergency, even something like a water shortage, a water outing like we had in Waimanalo a couple of years ago, we were able to respond and have the showers there. When they set up shelters, we're able to take the showers so that when there's an outbreak, Bob and his team responded, and they were there every single day so that we could keep people separated, those that were in isolation and those that were not. So these hygiene trailers have really come in handy, especially when the parks were closed throughout COVID. We were able to respond, and so the team worked really hard throughout the last 2 years, which has allowed us to expand. So we're so grateful for their hard work. We can go ahead to the next slide, please. Sorry, run back. These are the populations that we really focus on, and you can sort of see from the pictures what I'll share. But our main target population was always Title I school students. And then we realized, well, what about the rest of their families? And so we saw that those kids that were having the toughest times, many of those who were not passing their screenings because they had never been to an eye doctor before or a doctor before at that, came from some of these populations. And this is obviously where we see a lot of our minorities. We focus on our unhoused population, obviously with our shower units, and really develop the program based on their needs and their requests. You can see that we host our pop-up clinics in the middle of parks. We go right up to people's doors, in churches, as you can see in the top right. And then on the left side, you can see this is us giving a vaccine to a prison guard, an ACO. And you can see in the middle there, that's us giving to inmates. And so we realized throughout COVID that the populations that were not being addressed when the tests first came out, and then again when the vaccines came out, we noticed that those living in shelters and those living within the prison system were not getting that same access to the vaccine. And so we're really grateful to the Behavioral Health Administration within Department of Health that really helped us advocate to get those shots in arms. And we're very proud to say that we were the first organization to give a vaccine within a homeless shelter, the first organization to give a vaccine on the streets, and the first organization to give a vaccine in the prisons. And so we've now helped to vaccinate throughout all of the 8 jails and prisons, all the correctional facilities throughout the state. And we continue to bring this service into all of the shelters and encampments as well. One of the things that we did not expect at all at the beginning of the pandemic was once we started taking the tests and the vaccines, to these specific populations, Department of Health then asked, well, what about going to people's homes and taking it to our kupuna and taking it to our homebound, those living with disabilities, or really those that just have a hard time leaving the house. You know, they watch Tutu and all of the kids. It's very difficult for them to bring grandma in for a shot or in for a visit. So we started working with the Department of Health and the pharmacy groups to provide shots in home. And so you can see in that middle photo, we're at the door right there doing the test if they had symptoms or the vaccine right in their home. And what a blessing to be invited into someone's home and to be able to provide this service for someone who would have a very difficult time getting it otherwise. And so many of the patients that we continue to see through the Department of Health's immunization branch and their call center are homebound, and you know, their families are just extremely grateful that we can, you know, reduce the barriers for them and bring this service directly to them right in their place of comfort. I will say too, I'll point out the picture of our air balloons here, our balloon animal hats. We try to make these activities fun, especially when we started doing keiki vaccines. We brought support animals so that we had the dogs there for the kids to pet. You know, we had coloring books and games, music, entertainment. We really wanted it to be a family event. And this was one of the ways that we really, thanks to the Papa'ololokahi's 3R team, it really brought together all the Native Hawaiian Pacific Islander organizations. And so we formed this group that goes around and provides these health fairs together now with the Department of Health, with Papa, the Marshallese Community Organization, Keola Mamo, All Him Productions. We've really gotten all together, and every single week, at least 3 times a week, we're still providing these pop-up clinics where now, instead of the focus being on COVID, we still offer all of those services, but we're bringing in other social services, other health services, and doing so with all of the local partners, including the FQHCs. So these are just some of the populations that we focus on, and you can see in the pictures some of the ways that we deliver our services. Next slide, please. COVID was really a learning experience for us, and I'll let Bob share about these because these are specifically for the populations that he focuses on.
Yeah, so these are some of the events that I get pretty jazzed up about. As you can see, the first picture, the top left, that's our nurse Lara, and we're partnering there with an outreach worker from IHS. She introduced us to some people living kind of up the hill on Diamond Head above the road, and she helped us convince this guy to get a COVID vaccine. And then, you know, as you can see in these other pictures, we're going out to where people are. We're, you know, under the bridge, out in the bush. This one, the bottom left, that was pretty early on. As you can see, we're all in Tyvek suits there. You know, things were very uncertain, but so we're testing there. We're, you know, for some people who aren't really mobile, we're going into the tents and doing those tests. And, you know, partnering with our, again, with IHS, Dr. Wang, with Triple HRC. And then as you can see in the next photo, one of our nurses there is, you know, that's a great example of really going to where they are. This person was more or less immobile. And so, you know, we went to where that person was and gave him the treatment that was needed. And then I can't remember where this last photo is. But
this is at one of the public housing facilities. So you can see this sort of became the start of our street medicine program. So we're, you know, grateful for our work with the Department of Health. that allowed us to go onto the streets. You can see the nighttime photo here. That was 11 p.m. with Triple HRC and their team. They met us out to provide shots to our kupuna living in Chinatown early on. Anytime that we would have leftovers at the end of a pod, a point of distribution vaccine clinic, we were allowed to take them out and provide. So we would call everybody and say, meet us at this shelter, or meet us at, this street, at Hotel Street. We're going to walk around in the rain until we find individuals who will take the shot. And so this really taught us, we learned from our partners, our mentors really at IHS and Health and Harm Reduction Center and Partners in Care. They really all taken us under their wing, H4 as well, and showed us, it's about the relationships that you can develop with the clients. And so, getting someone to agree to let you put a swab in their nose in the beginning, you guys remember those swabs were pretty long and we had to go pretty far in. It's a pretty intimate experience to let someone that close and let someone in like that. So building that relationship over time, testing them over and over. We finally, we'd been talking to them for months. And when the vaccine came out, we already had that relationship of trust with them. They saw our dedication to them by coming to their encampment, coming to their home. And we were committed to doing that throughout the pandemic. And so now that we're offering additional services, we're able to build on those relationships and say, what else do you need? We're not just here for COVID shots or COVID tests anymore. How else can we assist, and how else can we support you in your journey upwards? And so, we really learned from our pilot here with COVID testing and vaccinations, but the importance of bringing translators, at times, bringing case managers who can provide what their true need is. Sometimes it's food insecurity, sometimes it's housing. This event that was here on the bottom left corner, some of you may recognize where that is. We also had people that were there that were able to take people into shelters and into the HONU program from that location. So really just trying to give people options and addressing whatever they feel is their most important issue at the moment, not forcing upon what we think is the biggest issue. At the time it was COVID vaccines, but really listening to them and letting us navigate their treatment. Next slide, please.
Yeah, so this is the examples of our shower trailers. You can see Cindy right there in the middle top. So sort of like with the testing and the vaccines from the slide before, this is an opportunity to bring these services to where people are. We're not saying you have to travel 20 miles to take a shower. We're going to come close to you. We go all over the islands. Today, for example, we're out in Waianae. Tomorrow we'll be in Waimanalo. Friday and Saturday we'll be in town. Tuesday we'll be on the North Shore. And that's the key. And we go there over and over. And so we see the same people over and over, and we start to build these relationships. Sometimes it takes a little while for people to trust us. Going into the shower is kind of a vulnerable situation. For many people, it's the first time they've been completely unclothed in quite some time. So, it takes a while, but that, coming over and over, we're here whenever you want us. That's the key to building these relationships. And so you'll see there's an event here where we've got some volunteers who brought some clothing, and we've been able to sort of wrap that in a little more regularly, having clothing at each event so that people can put on clean clothes after they get out of the shower. You can also see in the bottom corner, we were up close and personal with the lava. We helped respond to the Puna event from a few years ago. But again, that you'll hear us say this over and over. We're going to where the people are. And that's how we build those relationships.
And we really try to use the shower trailer as a hub, a way to bring services together. So not just our bringing the community together, but also our partner organizations. So using it as an umbrella to invite them, we have these weekly, if not bi-weekly events in different locations in the islands. And so case managers from other organizations, other homeless service providers will attend these events with us and utilize that as a meeting point with their clients or with their patients. And so we've, gone from just providing the showers to now having our own case manager there that can help with their Medicaid applications, that can help with their SNAP applications, help with their legal documents, help them with their VI SPDAT, try to get them into a program. And now we're really grateful that our street medicine team is now partnering up with our shower trailers so that, our patients, they can go in and take a shower, finally have that privacy that maybe they haven't had for a while, get a clean outfit to wear, and then get their wounds dressed. Our nurses are there to take care of their health needs as well. So it's really a one-stop shop, and we're grateful to the partners that come out with us consistently and make this a holistic effort week after week. All right, next slide, please.
So then these are, as Dara mentioned, these are the services that we're starting to stack on top of the showers, at shower events, and also at separate events that don't have the showers. So we've got the coordinated entry system going, as well as the VI SPDAT. And yes, so we're offering these services on Maui. We're helping with the legal documents. We're doing the SNAP applications, MedQuest applications, and case management.
So this picture is actually taken on Maui, and there we have a partner that has a shower vehicle that they run there. So we're grateful to, they can provide the showers there. So we'll bring in the extra services. So you can see in this picture, we have someone that's doing an intake for medical and someone that's doing SNAP and Medicaid applications. I have a little graph in there to show the jump of applications that we had through 2020. We went up at one point 12 times our usual number of applications. And so obviously our team had to grow, and we're grateful to Department of Human Services that has helped us to increase that team with our new Kokua contract with them. And so we have folks on every island, team members on every island that can help with these different applications so that we can get services to the patients. So huge jump, as we all saw. Next slide, please. So these are some of the lessons that we, and I'm sure many of you, learned throughout the pandemic, the importance of these public-private partnerships, working with different types of agencies to make sure that we could get services together quickly. The government organizations couldn't do it alone. They needed the CBOs. The insurance companies couldn't do it alone, but we all came together and brought our strengths to the table, and we're able to offer it together. And that's what we feel really blessed by, is that we have these core teams that we can work with now. Representatives from many different, diverse areas that can really come together to continue to provide these services, mobily, taking it to people where they are, building off of that trust that we've garnered over the past couple of years, being flexible, utilizing paper and technology, utilizing our mobile units and by foot, and being as creative as possible with our workforce. So, working with the nursing programs and public health programs, working with the high schools and their upcoming medical assistants that are trained. We've hired quite a few to help us throughout the pandemic, right from graduation. And I think something that Bob and I are most proud of is that we get creative with our workforce in a way that empowers our clients. And so the thing that we're most proud of is that we hire from within the community that we serve. So those that are formerly houseless and those that have been formerly incarcerated, we give them that chance to work with our organization. And again, be our bosses. Let us know, how do we connect with this community on an even deeper level so that we can provide a higher level of service. And so Cindy's here today to share her story and how this is applied to her. So I'll let you take it over.
Good morning, aloha. My name is Cindy. In the past, before I started working with Project Vision Hawaii, I was on the streets, and it was very hard because everything would be stolen from whatever your property is. But for me to be able to survive, what I was doing is recycles, going into bins from Waikiki and a variety of different locations. And then I happened to go to a church where my husband is working at, which is St. Mary's Episcopal Church in Maui. And he was there. As I approached Bob and he was working there, I asked them, what is this? Then they go, oh, it's a hot shower trailer. So I thought they were joking, and I kind of viewed it, went into it, and I said, I want to take a hot shower if it's a hot shower. So fortunately, I was able to take a shower, and hygiene was provided, which is towels, soap, shampoos. And since then, I followed them for quite a while. Then I was offered the job, and I said, just by looking at what you people are doing, I'm not sure if I'm capable of doing the job. So I was a little nervous, but I said, try it out. So as I tried it out, I really loved it. It's been 3 years since I've been hired by Project Vision Hawaii, which I really do appreciate them being patient with me. And I first started off with Here. Then from Here, I went into Vision. And Vision was a little bit different, so I tried my best. And then as time was going by, we were getting a little bit more busy. Then I went into helping with COVID for the paperwork, which is the testing work, and also the vaccine paperwork, making sure that everything was up to par, and communicating with our other team members. And right now, I'm really thankful for Bob and also my boss, Dara, for also offering me to be in the office, do a little bit more jobs. And you know, when I'm out there, I try to connect with a lot of people that I know that I used to hang out with, but they tell me, are you still working for the shower? I go, yes. And then they go, oh, how you like it? So I said, I love it, because, you know, everybody's patient, but it is patient, and it is to understand each other as a team. And so I recently realized that we're doing a lot of other things, such as like street medicine and meeting different people, trying to see what their needs are. But honestly, to my experience of what I think is, if we all can partnership together and get out there and work together with the people, they will be able to look more openly. Right now, they're actually all concerned because if they're on the streets, they can do what they want to. They don't have any time restrictions, just like when they go into like shelters and things like that. I know two of my friends are in shelters. They don't like it. And I asked them, why do they not like it? They say because there's a time frame. If you have a job, you need to get a letter from the employer to give it to them so that they can go out at a specific time to not be grounded. And if they work in the evening time, they come back at a later time, because I think their go time is 10 o'clock. They need to be in the shelter. Mm-hmm. But if they're not in by 10 o'clock, they get there like 10:30, 11 o'clock. They need to get a letter saying that they're due to that. they have to catch the bus going to work.
Barriers.
They will be late depending on what shelter, especially if they're over at Sand Island. You'll have to walk all the way over the bridge, and it's very dangerous. I know that experience because when I was doing COVID down in Halemaliola, I used to always walk over the bridge. So I know it does take time, but like about 10, 15 minutes, depending on how your body is. But yeah, so what I would say is if we could really join in together, get things going much more wider. And my focus right now, as I had spoken to Tara earlier, that I want to really expand it much more. But of course, I'll be thinking of how to expand it. I am grateful that I'm also able to work in the office. So that's my next focus right now. Thank you.
Okay. Thank you for sharing, love. So we really utilize the ideas that Cindy has, the experience that she and our other team members have, going through these difficult times and letting us know what other services should we bring. And one of the great ideas that Cindy had was, there are a lot of restrictions within the shelter, but people still need that treatment. So why don't we bring that treatment to them on the streets? And so one of our nurses, we're helping her through her APRN right now, and she's going to be focusing on psych so that she can provide psych in the streets. So she's been shadowing with IHS and HRC. And we're really grateful that we have that opportunity to develop that program, and Cindy's going to help us to understand, for those that are dealing with mental illness or substance use or trauma that everyone has that's living on the streets or within our correctional facilities. Can we bring those services of mental health right to them? And so that's something that we will be developing over the next few years, and really guided by Cindy and our other staff.
I'm going to go ahead and bring the slide deck down, but Project Vision has offered their contact information. One of the questions that was sent to me for you folks is, while our team and partners can connect with Project Vision and your programs on the Unitas platform, that's a great place for them to start and to look at. So Project Vision is part of the Unite Hawaii network, and so the Better Vision for Keiki, the Hiehie, COVID testing and vaccinations, and then also the SNAP enrollment programs are listed on the Unitas now. But one of the questions we got is, what's the best way for us to know about where you're going to be, what community events you have coming up, and what those specific dates and times and locations look like? Should we be looking at your website? Should we be looking at your social media? Where should we go?
Yeah, we post everything on social media and within the Department of Health's COVID website. So all of our health fair events are posted on the hawaiicovid19.com. And those we'd love to have you folks come and join us at any of those events. We have our weekly rotations for our Hiehie trailer on our website for each island, for Kauai, Big Island, and Oahu. On Maui, we don't own the shower trailer there, but we go along with the shower trailer with Maui Rescue Mission. And we have that rotation on our website as well. So those are weekly events, but we welcome you folks to reach out to us, and we can figure out a time and place that would be best, based on the populations that you'd like to serve.
Great, thank you.
Sorry, I was going to say on that last screen too, I had the number for the Department of Health call center. So if you folks have any patients that could benefit from these in-home services, Department of Health will take their information for us and then deploy our teams.
Great, and I'll go ahead and insert that phone number into the chat for everyone to refer to as well. We did have a couple of other questions. I mean, it's been such a pleasure to work with you folks on the Native Hawaiian and Pacific Islander COVID response team for over 2 years. Now, you really truly are addressing so many cultural and social needs for the patients that you serve. What advice do you have for us as we're looking to turn what are perceived barriers into opportunities? I feel like you folks are doing so much beyond health services. It's business administration, it's advocacy, it's partnerships and coalitions. You're creating opportunities, solutions, and recommendations that we would love to learn some of your advice.
Okay. Well, the key, is going. We think the key is going to where they are and listening to what people have to say. It's fine to bring, whatever service to some location, but if it's not something that they need or want, it's not going to do anybody any good. So, you go with a plan, but you're always flexible, and you're willing to adjust as needs change and that sort of thing.
Really see those barriers, like you said, as opportunities. For example, when someone is incarcerated, usually we see, someone sees that as they're difficult to get to. When someone is in a shelter or living in the bush, in a far off encampment, we actually see those as opportunities because, when someone was in isolation and quarantine for 14 days, we were able to have that time where they were truly engaged. We had their attention and we could really work with them over that time to bring them the services that, again, they asked for. I think the biggest key is listening. What we try to do is listen to those that we're trying to serve and ask, what is it that you need? And patience, we are learning that patience every single day it may not be what we think is best, but what is it that you need? And can we, once we build that relationship, can we make some suggestions? Here are some of the options that we can help with. And if we can't do it, we have a wonderful slew of partners that can also come with us and assist. So really building that partnership so that whatever barriers there are, we can go at it at a team, our full hui going in and seeing how we can break down those walls.
And I think that's a great place for us to talk with you next. Is you've grown so much over the past few years. You've grown throughout the pandemic. So what's next for Project Vision, and what is the future of the hope that you want to work on, and some of the partnerships that you want to create over the next couple of years? Sorry,
I lost my notes. Give me a second.
I'll go ahead. So one of the things that we're trying to do is enlarge the amount of services that we can offer with the street medicine program. And so currently we have nurses that go along with it in each of the counties that go along with our outreach teams to provide mostly wound care, but we'd like to increase what they can offer. We've recently partnered with the My Home program that does prenatal care and women's health care. The issue with that is it's not sustainable. Right now, we're thankful that we're able to bring in proceeds from the COVID shots and tests that we're still doing. But at some point, we're really going to need to address the issue of reimbursement for street medicine. And that's something that we would love to partner with you folks and the other insurance companies on, is how do we create that reimbursement for those nurses that are working on the streets? Because their location of service is not within a clinic, but we are still serving individuals and doing the same quality work. So, we're currently covering those costs, but because we think it's something that's absolutely needed. We've seen that it's absolutely necessary because most of our clients we want to keep them out of the emergency room, and many don't trust Western medicine. So how can we use our relationships to increase their health? A next area that we're moving into, since we are allowed, by Department of Public Safety and have a great relationship with them, what else can we do within the prisons besides just the COVID care? So we've started doing vision care within the prisons, and we look forward to finishing our rotation through all of the islands in a couple weeks. We're really excited about that, but also want to provide that reentry service. So working with DPS and other programs that have been in the prisons for a long time, how can we assist, especially with their Medicaid and SNAP applications, their legal documents prior to being released. And that's really for the prevention of homelessness. We saw through COVID with early release that many were, they went from being in jail to being on the streets, released right into homelessness. And so that's something that we'd like to work to prevent. Another lesson from COVID that we'd like to bring into the future with us is, the work of the 3R team, the work of that coalition, utilizing the partnerships for different churches and grassroots organizations that will help us go door to door. And so we're building a pilot project right now on the North Shore, where we've seen there are a lot of amazing groups, a lot of amazing outreach teams, but we're missing gaps throughout the North Shore. And so we're coming together to bring all those workers into one team and say, okay, if you have 2 outreach workers, you're going to get 10 streets. If you have 3 outreach workers, you'll get 15 streets. And we're going to make sure that we hit every single home and ask them, what services do you need? Do you have anybody that's homebound here? What services can we bring right to you? What are your barriers? And really giving them the opportunity to tell us their needs and work through that checklist with them, how we can help. And one of the things I'm eager to see is that we've partnered with the FQHCs up there. Something that we learned through COVID. Our first COVID test was given in partnership with the Waimanalo Health, with Dr. Mary Oneha. She trusted in us enough to go out to Waimanalo Beach Park together and changed her bylaws so that her team could work off campus. And now they're able to do, service within the community, directly in the community. And because they showed us the way and how to work with community health centers, we're now working with others, developing those MOUs so that we can bring in services that maybe they don't have in their center. Some of them do not have vision care. And so we'll take the vision bus right outside and they can offer to their patients to come in. And we're trying to bring the FQHCs off their campuses. So on the North Shore, if we can get Kahuku Med and Ko'olauloa to come with us to the homes, come with us out into the community centers, we'll each bring our strengths together so that we can offer the services that are needed by that community. And we look forward to taking that pilot throughout the state. So really divvying up the work into manageable pieces so that we don't have those gaps of individuals that don't know about these services, and really taking advantage of that opportunity, being invited into someone's tent or being invited into someone's home gives us a better opportunity to treat, to understand what the needs are and what their living conditions are.
Thank you so much. I feel like we've learned so much in a brief amount of time. We still have so many questions, so many ideas, and I think so many intersection points that a healthier and equitable Hawaii is definitely possible with the healthcare sector, working in partnership with education and transportation and the environment and housing. All of this is being demonstrated right now by you folks at the Project Vision team. I want to encourage all of our staff and our partners that when you see their mobile fleet at the beaches and the churches and the community events, please give them some aloha and mahalo Project Vision for their great commitment to Hawaii, and especially those of you that see them out on the neighbor islands. I wanted to just transition as we wrap up this really brief but informative episode 8 webinar. We just want to mahalo you, Dara, Cindy, and Bob. Thank you so much for your time, your sharing, the examples, and just the work that you're doing constantly. We want to thank AlohaCare's leadership team that's supporting this ongoing initiative and makes it possible so that we can work with community-based orgs and be a part of community-driven initiatives like the ones that you have shared today. And we want to mahalo everybody for starting your day with us to enliven a culture of health across our organization. We have more information coming to you via email. We'll send you the links for the surveys. I know that's a little bit humbug with the Google Chrome default with SurveyMonkey. And if you have any questions, please feel free to reach out to me. But for everyone, we just thank you folks for joining us today. Please continue to stay safe. Have a great rest of your day, and mahalo everyone at the Project Vision team. We appreciate you being with us and joining us this morning.
Okay, aloha.
Thank you.